Are you tired of the debilitating pain and inflammation caused by gout flares? If so, you are not alone. Millions of people around the world suffer from this condition, and finding effective strategies for gout flare prevention is crucial for improving their quality of life. One medication that has been gaining attention is Uloric 40 mg. This powerful drug has shown promising results in reducing the frequency and intensity of gout flares. By targeting the underlying cause of gout, an excess of uric acid in the body, Uloric 40 mg helps prevent crystals from forming and causing painful flares. In this video, we will explore the benefits and possible side effects of Uloric 40 mg, along with strategies for effectively managing gout flares. You'll discover how this medication works, what to expect during treatment, and how to optimize its effectiveness for long-term relief. If you're tired of being sidelined by painful gout flares, Uloric 40 mg may be the solution you've been searching for. Join us as we dive into the world of gout flare prevention and learn how Uloric 40 mg can help you regain control of your life. What is Uloric 40 mg? Gout is a form of arthritis that causes sudden and severe pain, swelling, and redness in the joints. It occurs when there is an excess of uric acid in the body, leading to the formation of urate crystals in the joints. These crystals can cause intense pain and inflammation during gout flares. Uloric 40 mg is a medication that has been specifically designed to target the underlying cause of gout by reducing the production of uric acid in the body. It belongs to a class of drugs known as xanthine oxidase inhibitors, which work by inhibiting the enzyme responsible for producing uric acid. By lowering uric acid levels, Uloric 40 mg helps prevent the formation of crystals and reduces the frequency and intensity of gout flares. Understanding gout and gout flares. To fully appreciate the benefits of Uloric 40 mg, it is important to understand the nature of gout and gout flares. Gout is a type of inflammatory arthritis that primarily affects the joints, most commonly the big toe. It is caused by the buildup of uric acid, a waste product that is normally eliminated through the kidneys. When the body produces too much uric acid or fails to eliminate it efficiently, it can accumulate and form crystals in the joints. Gout flares are the sudden and intense episodes of pain and inflammation that occur when the crystals in the joints are triggered. These flares can be extremely painful, making it difficult for individuals to move or even walk. Gout flares often come on suddenly, usually at night, and can last for several days or even weeks if left untreated. The importance of gout flare prevention. Gout flares not only cause excruciating pain and discomfort, but they can also lead to long-term joint damage if left untreated. Recurrent gout flares can contribute to the development of tophi, which are deposits of uric acid crystals that form under the skin and around the joints. Tophi can cause joint deformities and chronic inflammation, leading to reduced mobility and decreased quality of life. Preventing gout flares is therefore crucial for managing the condition and improving overall well-being. By reducing the frequency and intensity of gout flares, individuals can experience less pain, enjoy better joint function, and maintain a higher level of physical activity. Uloric 40 mg as a gout flare prevention strategy. Uloric 40 mg has emerged as a promising strategy for preventing gout flares. As a xanthine oxidase inhibitor, Uloric 40 mg works by inhibiting the production of uric acid in the body. By reducing uric acid levels, Uloric 40 mg helps prevent the formation of crystals in the joints, thus reducing the risk of gout flares. Compared to other medications used for gout flare prevention, Uloric 40 mg offers several advantages. It has been shown to be effective in lowering uric acid levels and preventing gout flares, even in individuals with severe gout or those who have not responded well to other treatments. Uloric 40 mg is also generally well tolerated, with a low incidence of side effects compared to other medications. How does Uloric 40 mg work? Uloric 40 mg works by specifically targeting the enzyme called xanthine oxidase, which plays a key role in the production of uric acid in the body. By inhibiting this enzyme, Uloric 40 mg reduces the amount of uric acid that is produced, leading to lower levels of uric acid in the blood. Lowering uric acid levels is important for preventing gout flares because it reduces the likelihood of urate crystals forming in the joints. Uric acid crystals are sharp and needle-like, and when they accumulate in the joints, they can cause intense pain and inflammation. By reducing uric acid levels, Uloric 40 mg helps prevent the formation of these crystals, thus reducing the risk of gout flares. Dosage and administration of Uloric 40 mg. The dosage of Uloric 40 mg may vary depending on the severity of gout and individual response to treatment. It is typically taken once daily, with or without food. It is important to follow the prescribed dosage and administration instructions provided by your healthcare provider to ensure optimal effectiveness and minimize the risk of side effects. It may take several weeks or even months for Uloric 40 mg to reach its full effect in lowering uric acid levels and preventing gout flares. It is important to continue taking the medication as prescribed, even if you do not experience immediate relief. Stopping Uloric 40 mg suddenly or skipping doses can lead to an increase in uric acid levels, increasing the risk of gout flares. Potential side effects of Uloric 40 mg. Like any medication, Uloric 40 mg may cause side effects in some individuals. The most common side effects include liver function abnormalities, nausea, joint pain, and rash. It is important to discuss any concerns or side effects with your healthcare provider, as they can help determine the best course of action. In rare cases, Uloric 40 mg may cause more serious side effects, such as severe allergic reactions or cardiovascular events. It is important to seek immediate medical attention if you experience symptoms such as chest pain, shortness of breath, or swelling of the face, lips, or tongue. Tips for managing gout flares while taking Uloric 40 mg. While Uloric 40 mg can be effective in preventing gout flares, it is important to remember that it is not a cure for gout. It works by addressing the underlying cause of gout and reducing the risk of flares, but it does not provide immediate relief during a gout flare. Therefore, it is important to have a comprehensive management plan in place to effectively manage gout flares while taking Uloric 40 mg. One key aspect of managing gout flares is maintaining a healthy lifestyle. This includes eating a balanced diet, exercising regularly, and maintaining a healthy weight. Avoiding trigger foods and beverages, such as alcohol, organ meats, and sugary drinks, can also help reduce the risk of gout flares. Another important aspect of gout flare management is taking prescribed medications as directed by your healthcare provider. This may include non-steroidal anti-inflammatory drugs, NSAIDs, or colchicine for pain relief during flares. It is important to discuss these options with your healthcare provider to ensure they are safe and appropriate for you. Alternative strategies for gout flare prevention. While Uloric 40 mg can be highly effective in preventing gout flares, it may not be suitable for everyone. Some individuals may experience side effects or have contraindications that prevent them from taking Uloric 40 mg. In such cases, alternative strategies for gout flare prevention may be considered. One alternative strategy is the use of other xanthine oxidase inhibitors, such as allopurinol. Allopurinol works in a similar way to Uloric 40 mg by reducing the production of uric acid. It has been the standard treatment for gout for many years and has proven to be effective in preventing gout flares. Lifestyle modifications, such as dietary changes and weight management, can also play a significant role in preventing gout flares. Avoiding trigger foods and beverages, maintaining a healthy weight, and staying physically active can help reduce uric acid levels and lower the risk of gout flares. Conclusion. Gout is a painful and debilitating condition that affects millions of people worldwide. Gout flares can significantly impact a person's quality of life, making effective prevention strategies crucial for managing the condition. Uloric 40 mg has shown promise in preventing gout flares by targeting the underlying cause of gout, excess uric acid production. By inhibiting the enzyme responsible for producing uric acid, Uloric 40 mg helps lower uric acid levels in the body, reducing the risk of crystal formation and gout flares. While Uloric 40 mg can be highly effective in preventing gout flares, it is important to work closely with a healthcare provider to develop a comprehensive management plan that includes lifestyle modifications and appropriate medications. If you are tired of being sidelined by painful gout flares, Uloric 40 mg may be the solution you've been searching for. Talk to your healthcare provider to see if Uloric 40 mg is right for you and take the first step towards regaining control of your life. With the right strategies and treatments in place, you can effectively manage gout and enjoy a better quality of life. Thanks for watching.